my name is Brittany, and today I'm going to be talking about my dramatic play box. So basically what a dramatic play box is just a box full of different items relating to a theme. So this is my box, and the theme that I chose was a vet hospital. And basically everything that's in my box is stuff that you would find if you went to a vet hospital. So the first thing that I have are these little name tags that say veterinarian, and then it has doctor, a space for the child to write their name. And this is good for the child who wants to be the doctor, so they would just put these over their neck and then wear these around. And then to go along with that, I have a lab coat or a doctor's coat, and so the child would wear this as the vet's coat, and they would also wear the name tag, which would show that they're the doctor in this play scenario. And so the next thing for the vet's office is I have a bunch of different animals. So we have an owl, and we have a pet dog, and then we have a little bunny rabbit, and a little duck, and then we also have a chicken. So the children have a bunch of different options of which animals they'd like to play with. And then relating to the actual vet, I have open and closed signs. So what the child can do is in the morning when they decide to play with this, or whenever they decide, they can open up the shop, and so they can lay this out and say that the shop is open. And then at the end of the day, when they're ready to be done playing or whatever, they can put the closed sign out and show that the vet's office is now closed. So that's just good for them to correlate that. And then next, say one child is bringing in their pet dog, and then the other child is the veterinarian. The vet would have this little check-in sheet, and basically it allows them to diagnose the animal and say like what's going on. So there's a spot up here for the pet name, and this would allow the children to practice writing names. And then they're able to circle whichever animal's brought in. So if a dog was brought in, they would circle the dog. And then down here, it allows them to say if the temperature was normal, if it had a fever, so they can check for the temperature. They can also say if the animal is sick or if they're doing well. And then there's also a spot down here for treatments. So however the vet decides to treat the animal that was brought in, they can mark if they gave him a shot, gave him some medicine, a bandage, or just decided to tell him to rest. So this is good for the children to do this is language and literacy skills, but also fine motor skills just by writing. So next, just some treatment options for the animals that the vets can do is we have a thermometer. So this is just for the vet to take the animal's temperature. And then next I have some popsicle sticks, and these are good to be used for the tongue suppressor, so they can tell the animal like to open their mouth, and they can check on their mouth to see what's going on. And then next there's some tweezers. So they can just do whatever they want with it with the tweezers, but it's also fine motor skills because they're having to squish the tweezers like with their fingers. So that's good for that. And then next we have a stethoscope, so the child can just use the stethoscope and check for the heartbeat in the animals, and this is just fun for them to do. And they can say if it has a good heartbeat, if it doesn't have a heartbeat. And then next I have this roll of toilet paper, and they can use this as a bandage. So if they just unroll part of the toilet paper, then they can, like let's say the arm is messed up on the dog, they can just take the toilet paper and wrap it around the dog's arm. And this is another fine motor skill because they're having to use their fingers to like wrap something small around this dog's arm. And so now the dog's arm is fixed, it's not broken anymore. So that's a good example. And then also I have a bottle of medicine, and the lid is child locked, so they can't open it even if they wanted to. And then also inside are just some Good and Plenty candies. But this is good if they want to diagnose the animal, say they need some medicine, so they can just pour the medicine in the animal's mouth, and that's good for them. And then next, let's say the animal comes in and needs an x-ray. I have an x-ray sheet that the vet could give to the person who brought the animal in. So this is just a bunch of different interacting between different roles, which is also a social emotional domain that they're practicing. But this is just an x-ray, and they can explain it and show that to the person who brought their pet in. And then I have a scale. So on this scale, it just says 10 pounds, and so the animal can, or the vet can take the animal and just put it on the scale, and then they're able to read that this says 10 pounds, and they're also able to learn that LB stands for pounds, which is a good thing for them to learn. And then lastly, at the receptionist desk, when they decide to pay for their vet visit, I have just some fake money, and this is good for the children to learn how to count. So let's say the vet visit was $30. The child could count out a 10 or a 20 and say that's $30, or they could just take some money and hand that to the receptionist if they don't know, so they're not missing out if they're not sure how to count money yet or add numbers. But basically, this was my project, and I really enjoyed doing it, so thank you.